Another wedding patient, she honestly had an awesome smile. Like if you were walking down the street and she walked past you, you would look at her smile and be like, oh, really pretty smile. But for her, it was one of her biggest insecurities. And it was for reasons that only made sense to her. But sitting down and listening to everything that she wanted and her vision and taking the time to process through that together, after listening, it really wasn't a big fix. It was a fairly simple procedure. And ultimately, when we were done, she was so extremely grateful because we were able to just hash things out before we even started. And the final product was just awesome. So, bonding versus veneers, that is the age-old question in cosmetic dentistry. And both types of procedures have their strengths and weaknesses, but ultimately it depends on the goals. And again, I feel like I'm harping on this, but sitting down and talking to the patient and figuring out what's your timeline, what's your goal, what is most important to you, um, taking notes of like, how old is this patient? Is the patient someone who wants to get a treatment done that is immediate, or do they want a more long-term solution, right? It's really dependent on the patient on which one is better, bonding or veneers, right? But there's pros and cons to both. One of the pros of bonding is that it could be done almost immediately. One appointment and you're in and you're out. The trade-off is that it may not be as robust, right? The composite is a good tool to figure out, okay, this particular thing, the smile, the change in my smile is what I want. And I want to try this for a couple years, maybe 3 to 5 years. And when that bonding is, a little bit lackluster because the polish is worn off or something, right? Do I re-up the bonding, right? Or do I jump into the porcelain veneer? And that goes into why the porcelain veneer is awesome, right? The porcelain veneer is where we can really take that artistry of dentistry. And again, going back to making everyone's smile look like they were born with it, but making it enhanced, right? You can add the small nuances like the frosting or the translucency or the little individual globes that people don't really think about when it comes to a beautiful smile. The porcelain veneer has all that power, right? It's an awesome tool to get patients where they want to be. When it comes to whitening, avoiding that post-op sensitivity actually starts before the whitening happens. So taking some special steps to use the correct type of toothpaste, making sure that your teeth are healthy, getting that exam before you get that whitening done, right? Making sure that we don't exasperate any gum issues or any cavities that may exist. That's the first step, right? And then once you get all that taken care of, going to a place that does these types of procedures every day, right? Every month, every day, multiple procedures, right? And it's not just one of those novel things that you do every once in a while. Those types of places like BCCD, we know exactly how long to keep the whitening gel on there, what light source we use. All those things go into making sure that you get the best result without the downside, right? And then, if you do have sensitivity afterwards, right, which happens, it happens. It's transient and it tends to go away after a couple days, right? But how do you manage your teeth after getting the whitening? If it's sensitivity, what types of products can we use to reduce that sensitivity? How can we make that healing process faster? And then when you get the whitening done, how can we keep that whitening at that level where you left the office, where you're not getting the stain and you're not getting that turn back to what you were before you got the whitening? So all those things are all part of being part of a cosmetic dental office. I think that whitening has these common misconceptions, and when whitening's done correctly, you should be able to predict at least between one standard variation of what that final shade's going to be, right? And know where the limitations are and how to get there. And that's what cosmetic dentists do. So, cosmetic dentistry has this stigma about it where it's like smile makeover, like big enhancement, change your life. But it's not always that. It's not always the Hollywood glitz and glamour. It could be something as small as contouring their teeth and making that polishing their teeth to make them shine a little better, or sculpting the gums to frame the smile a little better. We use Botox sometimes, right? That's a big thing in aesthetics, but we can use it to bring a gummy smile down. So no, it's not really a big thing where every patient needs a smile makeover to feel confident about their smile. It could be small things like gum contouring or a little bit of Botox to bring a gummy smile down, or just replacing an old filling that doesn't look very good, or maybe just some whitening. And I think that those small tools are the best thing to have in the tool belt to boost people's confidence.